Hey guys, happy Wednesday. It is sweltering out there. So I just pulled in from work and I thought I would just take a brief moment to just talk about my presentation that I'm going to be having at Sticks and Stones in Newtown. You don't want to miss this, guys. This is information that is going to be instrumental in assisting you in navigating this whole cancer journey. Okay. I lost my mom to cancer in 2013. She was diagnosed in 2012 and she transitioned in 2013. And I have made it my mission. And when I say I have been 100% in, that's an understatement. So I have invested time, finances, I've traveled just to learn as much as I can about integrating cancer care or integrative cancer approach. Because in my clinical experience of over a decade, this is what works. Okay. Now, there are some exceptional cases where there happens to be a recurrence because with conventional treatment, they are excellent at shrinking that tumor for the most part, right? That's where they see their success. That's where standard of care sees their success, is shrinking that initial tumor. However, right, chemotherapy addresses rapidly dividing cells, which are characteristic of tumor cells or the cells that make up that tumor. However, it does not address the stem cells effectively because the stem cells behave a lot differently. First of all, they are not rapidly dividing cells. So it's those stem cells that remain after the primary tumor is treated and shrunken. And so often we hear patients coming to us saying they were given a prognosis, basically told that there is no evidence of disease. So they were declared NED, right? Which is no evidence of disease. But then in a couple of months, 6 months, sometimes years, sometimes, right? Maybe several years after, 5 years out, maybe 8 years out, even 13 years out, they're back. Either with a recurrence or a brand new cancer, right? Cancer is cancer. It's just where it shows up, right? Meaning that the cancer shows up in a different place and is classified as a new cancer. Is it new? No, right? Those aberrant stem cells that remained then came back or formed in a new location in the body, a new site. But guess what? This time, what works for the original tumor will not work for that recurrence, right, of the malignancy, which is sometimes classified as a new cancer. It's the same cancer showing up somewhere else. Okay, so the stem cells need to be addressed, and that's vital. Okay, so this is some of the information that you're going to learn if you invest a small amount of your time, right, and a small amount of your money to come and see this presentation, right, and learn and become empowered so that you can make the best informed choice coming from a place of being thoroughly educated, right? So it doesn't mean that, that 1.5 hour session is going to thoroughly educate you and give you every single piece of information that you need. But guess what? It's going to give you enough that you can now know where and how to navigate, right? where you can now know what additional information you're going to need, right? So that you have a favorable outcome at the end of your cancer journey. Okay? Come hear me out. Become empowered. Get your education, guys. If you are a caregiver, if you are the loved one of somebody who has been diagnosed with cancer, if you are the individual who is housing the cancer, or if you just want to know, come out, guys. You will not waste your time at this event. Okay? So I hope to see you there. This is going to be at Sticks and Stones. You want to check out my Facebook page, Adonai Optimal Health and Wellness, right? We've had a change of date, right? So we had to change the date. It was originally scheduled for the 13th, but we had to push it back. So go ahead and check out my Facebook page at Adonai Optimal Health and Wellness. The information is posted there. The information is posted on Instagram. The information, or the link to the information, is posted on Twitter. It is posted on LinkedIn. So all you have to do is look for Adonai Optimal Health and Wellness. I am Dr. Witten. I am the clinic director at Adonai. Find the information for Sticks and Stones. Come on out and be empowered. Okay? I hope to see you there.